Good evening. I hope everyone is doing okay. I am Dr. Marwa Mustafa. I'm working as a radiologist in the Dhaman Health Assurance Organization. Today we are here to talk about a very important topic, which is breast cancer. This month, as you might know, is the Breast Cancer Awareness Month. It is marked in countries across the world every October, and it helps in attracting the attention and supporting the awareness of the early detection of breast cancer and also the early treatment of this disease. Let's begin with which group of people are at high risk of breast cancer. Breast cancer is commonly found in women. Women which their age is under 40, the rate of breast cancer is slim, while those with increasing the age, the breast cancer risk is more. Another group which are highly risk of breast cancer, those with family history of breast or ovarian cancer. Let's begin now with the ultrasound. Ultrasound is one of the important techniques that we use to diagnose the breast cancer. It is safe, painless, and also not expensive technique. Breast cancer is easily accessible and it's available everywhere. In breast ultrasound, we use the ultrasound waves in order to create an image for the breast. We know also more about the details of the composition of the tissue, and also we get an idea about the blood flow in any concerned area. This is why we take our image in real time. All this helps the radiologist to know more about your breast, and if you have a lump, it's benign or it is cancerous. And if it is cancerous, what's the level of this? Another imaging technique which is very important for those females above 40, we use it as a screening even without any symptoms, is mammogram. Also, mammogram is used to make a follow-up for known case of breast cancer. Mammogram is a technique using low dose of X-ray, and we follow the 10 days rule of imaging, which starts from the first day of menstruation, to keep safe from being pregnancy while taking the mammogram. Also, mammogram is effective and beneficial exam which can detect the cancer even it is very small or at very early stages. What does a radiologist needs to know from the mammogram? He needs to know if there is any mass, distortion, asymmetry between the two breasts, or even if there is any calcification. Mammogram, it is proven by statistics whenever it is used as screening. This makes the mortality rate less. Mammogram, which we are talking about, is the 2D mammogram. There is another one, more advanced, called the 3D mammogram, in which we can use the mammogram to screen in the high dense breast. And also it helps us to get the very small lump can be diagnosed through this very dense breast. Let's know now if there is other step we can follow if there We finished the ultrasound and we finished our mammogram, and still there is queries. Yes, there is. The MRI, the magnetic resonance imaging. We use the magnet waves in screening. Magnetic MRI helps us to get a 3D image. And also, it helps us so much to get a very clear image for the breast. It is completely radiation free. MRI helps us so much in many cases, especially for pre-surgery planning phase or even the treatment evaluation response. However, the MRI is expensive and time-consuming, and also the MRI is not fit for every patient. Some patients, they have metallic medical device within their body, so they don't fit for the MRI. After all these steps we spoke about, there's other methods we need? Yes, there is. One of these methods is the ultrasound-guided biopsy. The ultrasound-guided biopsy, what is it? It's a minimally invasive procedure that we acquire a small tissue from your breast and send it to the lab to search for cancerous cells. Now, for the ultrasound-guided biopsy, it's done by local anesthesia, and it's done also within the ultrasound room. Before all these methods, I want to remind you with a very, very important step, which is the self-assessment for your breast, that you can do it at home regularly in a very simple method that you can take it from your family doctor. In this, when you make a self-assessment for yourself, you are searching also for any lumps, any nipple discharge, any abnormality. If you discover one of these, at this time you have to get immediate medical advice, a professional medical advice. And if you have any abnormality, at this time you also have to go to annual checkup. It is just once appointment to your doctor to make a checkup for your breast, because breast cancer really is a very common cancer nowadays. And as we mentioned before, there is a special group of people which are at high risk of breast cancer. So please don't forget always to do a self-assessment for your breast. And if you notice anything, you have to proceed to one of the procedures that we mentioned. Choosing which procedure that fits you, this depends on the doctor evaluation. He will guide you which method you can use. And please, I'm always reminding you, the earlier the detection of the disease, the earlier treatment you can get, the less fatality we will have. So, thank you so much for your attention and for your listening. And if there is any question you want to share, thank you, everybody. I hope it was useful, and I hope it was clear for everybody. I tried to use as much as I can the simple method to explain for you. I will be happy if anyone wants to share his questions. One of the questions I got They are asking about the age, as I mentioned before, 40. Mammogram is done above 40. So there is no questions, no more questions. So thank you everybody for listening. I hope it was useful again. And any question you can share with us on the Dhaman Instagram. So we have one question here, why I can't do below 50? No, we do the mammogram from 40 and above. This depends on the sensitivity of the tissue. The breast tissue is more sensitive to the mammogram when we across the age of 40. Thank you, everybody. Thank you for watching, and I hope to see you again and again. Thank you. We got one question now. How often should it be done? If we are speaking about the checkup, it will be annual checkup. And the kind of the checkup depends on the age, and your doctor will decide this, whether it will proceed to the ultrasound or it will proceed to the mammogram, according to the age, according to the family history. So, no more questions? One question here, can I go to the MRI directly or I have to pass through all the exams? No, you cannot go to the MRI directly. We usually proceed first with the ultrasound if you are less than 40, or the mammogram if you are above. If there is finding or there is any queries, we can proceed to the next step. We can proceed to the MRI. But we never proceed to the MRI directly. It's not our first choice imaging technique. It is maybe the second or the third, according to the patient and the case. Somebody is asking about mammogram. Is it painful? It's a little bit painful, but not so much. You can do it a little bit pain, but everyone has to. As I mentioned before, you have to do it annually. Thank you, everybody. Thank you for your questions, and I hope I explained the answer clear for you now. And I'm always happy if anybody share any questions or need more information. He can share us on the Dhaman on the Instagram. Thank you, and hope to see you again and again. Thanks, everybody.